This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. Alpha Natural Resources, an energy company dedicated to respecting the land. Alpha Natural Resources, we power the world through the energy of our people. Haley Buick GMC, the place for a new Verano or Terrain Denali, in Richmond and online at haleybuickgmc.com. Everywhere there are lighting poles, there's one more opportunity to save money. Intelligent Illuminations provides cost-effective wireless lighting solutions for roadway or area outdoor lights. Kanawha Valley Arena, Virginia's cowboy town, hosting an array of events from Civil War reenactments to diesel truck pulls. More information online at virginiarodeo.com. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. So what do you do? Information about getting involved in advanced technology careers, making everything from clean energy to life-saving medicine, is available at dreamitdoitvirginia.com. Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
Welcome to This Week in Richmond, and welcome back to Senator John Watkins. It's been a while since we've had a time to have a conversation on This Week in Richmond. Let me start by telling our viewers that we're having the conversation on March 6, which is day 58 of the scheduled 60-day session, and the die has been cast today that adjournment will be taking place in a couple of days without a budget. Correct. And you'll be awaiting the governor then to call you back into special session to resolve budget matters. Senator Watkins, you've been serving in the General Assembly since 1982.
Correct.
In the House of Delegates up until 98, and then the Senate since 98. While your seniority, as I was looking at it in the Senate, is number 12, if you look at the number of years served, you're up about number 3 in the Senate as far as years served.
Right.
The gentleman from Powhatan, as you're recognized, representing parts of Powhatan, parts of Chesterfield, and some of the city of Richmond.
Correct.
So,
yes.
So we appreciate your being on, and the subject of the hour is the budget and about Marketplace Virginia. We may, if time permits, talk about some other matters, but would be very helpful to have you explain Marketplace Virginia to our viewers. And I'll tell our viewers that we've extended an invitation for someone to come on a show following years if they would like to say why we shouldn't do Marketplace Virginia. But today we want to hear from you about this plan and what it would be if we move forward.
Certainly. David, the best way to explain it is that the Affordable Care Act that passed about 3 years ago by the U.S. Congress put in play a setting that would change the arrangement of health care and how it would be afforded and provided for individuals, particularly in the spectrum of income below 400% of poverty. Virginia pretty much objected to the Affordable Care Act. I didn't personally. I did not like the way that it came about. It was taken to court. It has been all the way to the Supreme Court of the United States and was found to be appropriate, and with a few minor tweaks was ruled constitutional and implemented. The passage of that act provided a mechanism that a number of taxes and fees were put in place that affect all Virginians. All of us are paying, either in the form of increased premiums because of the premium taxes going up. Those of us at certain levels of income, income taxes going up. There are changes in Medicaid prescription law, fees associated with that, so, but many others. But in all, here in Virginia, we're paying about we're paying about $5 million a day in taxes. It comes to about $2.9 billion a year overall. So it's a significant amount of money. Part of that money has been channeled back to Virginians who have signed up through the Federal Exchange for insurance. The Federal Exchange picks up individuals who are at 139% of poverty according to the size of the family, number of dependents, and income, up to 400%. And it incrementally goes down in terms of any subsidy or the types of policies that are offered as the incomes rise. So that piece is completely in play already. We opted to not have a state exchange. We opted to not put an exchange in to pick up that part of the population. But what it did do is it left the population of 138% of poverty down to where Medicaid covers today without coverage. They have no insurance. Many of them, approximately 400,000 of them, don't qualify for Medicaid as it's currently offered here in Virginia. So they are without any protection, coverage, or benefits, if you would. We felt, or I felt very strongly, that to pursue the pure expansion of Medicaid would be to add to the problems that the Medicaid system has. I'm not excited about making that system bigger than it is. It's all government, and I felt like we could come up with a better idea. So what I came up with, and in conjunction with the plans, the people that offer health insurance policies, I sat down and met with them. I sat down and met with the Secretary of Health and Human Resources. I sat down and talked with the people from Medicaid here in Virginia about how to approach this problem. And what I concluded was that, number one, we needed to set up a mechanism that the individuals 138% and below would be eligible to receive a health insurance policy. Not one that just covered them when they came into the emergency room, but one that provided them with preventive care, one that provided them with a means of accessing a family physician, one that looked to their overall health before they got in a tragic situation where they couldn't get anything done but go to an emergency room. Right now, that's what they are. That's where they find themselves. So if we provide these insurance policies, and they would be driven down actually below the 100% poverty level, because there are several individuals who are below 100% that don't have Medicaid here in Virginia right now. And it would be able to pick them up as well. Now, the way of paying for it, what we envision and what we have put into position is what we refer to as a private exchange. For the most part, it is run by the insurance companies. Right now, the State Corporation Commission oversees the management, if you would, of the plans that are offered by the insurance companies in the exchange, which is 139% and up, but they would also have the plan management for those below 138%. Many of them would be similar policies. But we would fund those premiums, the payment for those policies, using the federal dollars that Virginians have contributed in the form of those taxes that I spoke of earlier in the show. All of those dollars have flown into, have been forwarded into an account that's credited to Virginia if we use it. Now, if we don't use it, then it goes to other needs on a national basis. I think we need to recover some of the money that was intended for health care in Virginia to pay for health care of Virginians. And that's the mechanism that we have used. So what would happen is an individual that would be holding one of these policies would get the medical care, and the physician or the provider would then file the appropriate documentation, the appropriate coding for payment with the insurance company. The insurance company would then file a warrant with the exchange, and the exchange would file warrants with CMS, the federal agency, and the Treasury that handle the disbursement of those dollars back to Virginia. And then they would be allocated to the companies to pay the premiums for the coverage of the Virginians that had the policies. The beauty of this is, too, that Virginia finds itself in a, there is concern, one, they're going to run out of money, that the federal government's going to run out of money, and two, that there's a liability associated with us offering these plans. Well, if you set them up in a private insurance mechanism, the individuals that own or hold those policies know from the very beginning that they are agreeing to a policy that is there only as long as the funding is there to pay for it. And it establishes no precedent on the part of the state is remaining liable for the payment of that. It's up to the federal government to keep up its end of the bargain, if you would, in order for the coverage to continue. But it's taking a managed care system and putting it in place for all individuals that get covered by these plans. Virginia has been in the lead around the entire country with utilizing managed care in its Medicaid system, and we indeed use it in the Medicaid system. Many other states have never done that, and they're far behind us. And you hear people talk about the fraud and waste many times in Medicaid. Well, to use the managed care system in the policies that we're talking about, it avoids that, because number one, you've got the insurance companies that they are going to oversee how the payments are made, to whom the payments are made, and they will have their own checks and balances to keep the fraud and abuse out of it. Most of the fraud and abuse, about 95% of it, is in the fee-for-service mechanisms that remain in many states across the country in providing Medicare service. Now, we have some fee-for-service areas in Virginia that what I intend to do is see that we convert them from a fee-for-service plan over to a managed care plan. Many of them are the ID and DD waivers, for example, and that's the area of the largest growth in terms of dollars here in Virginia over the past 10 years. But they need to be tightened up, if you would, and put on a managed care system. Long-term care as well in nursing homes needs to go on a managed care system. And I think we can do that. I think with the assistance of the plans, the insurance companies that are going to be involved, it is to their benefit and it is to Virginians' benefit that we implement managed care throughout that system. And that's how it would work.
I've heard comments that there are some other states that are doing something similar. Are there states that have gotten permission, if you have to get that, to do something similar to this?
Sure, yes they have. The latest one is Arkansas. But what was different, and I didn't model this after any one state particularly. There are several of us that kind of came up with this on their own, and as we, fleshed it out, what we found is that yes, there are other states that are doing things very similar. Arkansas is one, but Arkansas was a total fee-for-service system. So not only did they have to switch to a private exchange, but they also had to go into a managed care system, which they had never done before. Michigan has a system like this. I think New Hampshire has a system like this, and I believe Iowa has a system like this.
I've seen quite a few things in print and newspapers and all about this, and I don't know, it could have been you, but I don't know who suggested that it was a plan somewhat comparable to a Republican plan to privatize Social Security. That's another whole area. We don't get into Social Security today. That's federal, but that it is a privatizing plan, and I think the writer of this particular piece was wondering why more Republicans didn't support it and why Democrats were supporting it. Kind of interesting.
Well, I don't know. David, you know me, and I try to find solutions to what I see as are problems, and sometimes I'm willing to, go against the grain a little bit, if you would, with colleagues on both sides of the aisle. When you're solving a problem, it's not about politics. It's about solving the problem. And I've been accused by some members of the House of starting off with the compromise. Well, that tells me one thing. They know that this is where they've got to wind up. They just can't figure out how quite to get there and save face. And I understand that. I mean, this is not as simple as I have probably characterized it in the last 15 minutes. It's not going to be without its difficulties. It's not going to be without some very hard work on the part of a lot of dedicated people in the private sector and the public sector.
And should it pass, become law, it's not something that's forced on anyone.
Right.
And people, if there's someone out there without that coverage and they don't want to do it,
you can't make them get the coverage.
Now, is there something in it where there would be a small payment that the individuals would make toward this?
One of the proposal that we're putting together would request or require a dedication of up to 5% of the family income, which is a reasonable figure, but it wouldn't, in the lower echelons of the income level, it probably would be a lot less than that.
Using that percentage, help me and help our viewers understand if you were translating that into potential raw dollars for a...
Well, a family of four at 138%, for example, would be $32,500, something like that. So if you take 5% of that, it's really not that much money.
Maybe $100 a month or something
like
as
that,
I'm
yeah.
calculating it
Between
out.
$100 and $150 a month, yes.
To have health care coverage for the entire family.
For the entire family, right.
Yeah, and I'm sure that...
And there is something to be said for making sure that everybody has a little, if you would, skin in the game. And that would be one mechanism. Another would be to incentivize people with copays. If you go to a family physician when you have an earache, the copay may be $10. If you go to the emergency room with an earache, the copay may be $50. So it would incentivize you to go to the right place.
And from everything I've seen, healthcare professionals of all sorts of organizations, hospitals, all the providers, are urging the passage of this.
They are. And this is another whole side of it, David, that I didn't even get into, but it's very disconcerting because the way the Affordable Care Act was put into place, there were many cuts, if you would, in Medicare reimbursements. They rearranged the deck, if you would, with regard to indigent care payments that would go to hospitals that took care of indigents as an offset for the expense for that care. A lot of those things are going away. So if we don't put something into place to ensure that there's going to be payment for services provided, then the margins that these hospitals work on will be so diminished that we're going to start losing them, particularly in the rural areas where they don't have a huge patient base to work from, and they have a high percentage of Medicare and Medicaid type patients. We've already seen one hospital out in Lee County close, largest employer in the county, and they just had to close. Korean Hospital in Roanoke, their margins are so jeopardized that they're very concerned that they will have to start cutting jobs almost immediately.
As recently as today, and I don't know if you've had a chance, if they've talked with you, and if you've had a chance to review it, that someone has come out with the concept of a trust fund, and the money going to a trust fund. So I only mention that to say it looks like that things are still trying to be evolved,
Right.
to try to...
Well, I don't think I have any problem with that. The unemployment works that way with the federal government. It's a trust fund that employers send the employment taxes to the federal government, both the state unemployment and federal unemployment, and it's in a trust. And then as you pay out unemployment benefits, then you warrant against that trust fund. And it's pretty much the same thing is being done with CMS. It's a trust fund there that is set up, for each state. But if you don't expand, if you don't provide care to that group of people, then none of the money comes back to the state. Oh, I won't say none, but the vast majority of it doesn't come back to the state.
We have time to maybe ask you to address one other point.
Sure.
Again, I've heard it said that those of us who are fortunate enough to have insurance,
Correct.
glad I do, that we are really subsidizing the hospitals for the indigent care that they are required to provide.
Correct. It's called cost shifting, and the insurance policies, the premiums that we pay, offset the total cost of hospital and provider health care. So, when there are groups that can't pay, their expenses wind up going against our premiums, and our premiums go up as a result.
Well, Senator Watkins, I know that you and your colleagues are going to be involved. In fact, again, reminding our viewers that we're talking on day 58. The session will adjourn on day 60.
Correct.
They're seeing this program now that when we're in the in-between time, till the special session is called, that you all will continue to work to try to find a way to bring the two chambers together.
We will.
To get this resolved.
There are 6 conferees from the House and 6 conferees from the Senate, and we will continue to try to negotiate a settlement, if you would.
Senator Watkins, thank you so much for being on This Week in Richmond. We look forward to talking with you again in the near future.
David, thank you very much. I appreciate the opportunity.
This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. Alpha Natural Resources, an energy company dedicated to respecting the land. Alpha Natural Resources, we power the world through the energy of our people. Haley Buick GMC, the place for a new Verano or Terrain Denali, in Richmond and online at haleybuickgmc.com. Everywhere there are lighting poles, there's one more opportunity to save money. Intelligent Illuminations provides cost-effective wireless lighting solutions for roadway or area outdoor lights. Kanawha Valley Arena, Virginia's cowboy town, hosting an array of events from Civil War reenactments to diesel truck pulls. More information online at virginiarodeo.com. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. So what do you do? Information about getting involved in advanced technology careers, making everything from clean energy to life-saving medicine, is available at dreamitdoitvirginia.com. Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.